Good day, everyone, wherever you are. You know, I've thought a lot about the message that I want to convey to you today. And as many of you know, my nature and my true character is to be positive and optimistic and congratulatory. And I definitely will be. I'm going to share some of the great accomplishments in health over the last year plus actually, hoping that's going to serve as a source of inspiration for many of you. Now, at the same time, I really feel this need to impart a sense of urgency that I'm feeling about what we all need to do to be better, not just for COVID-19 response, but for all of our health programs and operations. So why do I feel this sense of impending doom? Well, maybe that's a little too much. It's more like trepidation or concern. Well, it's because history has shown us that during a crisis, people are predictable. They generally become more risk averse. They live their lives a bit more conservatively, and they even develop stronger feelings of religiosity. In the health world, some of those predictable thoughts and feelings center on the mental and physical exhaustion from doing our parts day in and day out. Maybe frustration from attempting risk communication to an incredulous population, and a realization that our systems and policies have not been serving us well. All of this leading up to a pledge and in fact a determination to never let this happen again and to do things better when, of course, things calm down and there's a bit more time. The problem, as I see it, is that those feelings and that determination won't last. When crises end, people tend to set aside those weighty concerns and instead seek out risky behaviors. Case in point, we saw the jazz age arrive after the 1918 flu pandemic, and the baby boom followed the Second World War. And according to the New Yorker, there's reason to believe that the 20s will roar again in this century. Now, actually, we've talked about being more ready and doing better before. So as I prepared for today, I was reflecting on my 2017 keynote that was delivered for this Esri Health and Human Services GIS conference. And at that time, we talked about the need to get together and be more prepared, to gather our foundational data, and to train and drill on configuring quick maps and apps to enhance awareness and make data-driven decisions. A few months later, as if in complicity with me and my message, Bill Gates was interviewed in The Atlantic in an article that was ominously titled, "The Next Plague is Coming, Is America Ready?" And then there was the depressingly descriptive and wordy subtitle, "The Epidemics of the Early 21st Century Revealed a World Unprepared, Even as Risks Continue to Multiply. Much worse is coming." Ugh. Well, after reading this article, though, I realized that Bill Gates and we have a lot in common. And it's not only our good looks, but actually we also have an innate penchant for optimism, and we have an emphasis on promoting positive forward progress. But our global state of preparedness got him worried too. In that Atlantic article, he talked about running simulations that predicted the potential for a severe flu pandemic that could kill more than 33 million people worldwide in just 250 days. Thank goodness this wasn't that. But he remarked on the world's continued inability to be adequately prepared for something like this. He said, "This is the rare case of me being the bearer of bad news. Boy, do we not have our act together." So, okay, I realize this isn't new information. We all know that we weren't prepared. But I just say, wow, this time right now, here and now, this is a moment. This is an opportunity to take advantage of all of the attention on health and the budget and the resources being devoted to health in ways that we've never seen before. This moment, however, won't last. Something else will command our attention, so we need to make the most of this. And while I can't answer all of the challenges, I can credibly speak to the important and transformational role that GIS can play. Now, happily, we have a really good example of transformation that we can learn from. We saw our peers in the public safety industry go through the same kind of thing. Now, they had procedures in the early days, like a Sharpie and a paper map for situational awareness, but they weren't collaborating, sharing information, or working in a modernized technology infrastructure. So for those professionals, it was 9/11 that demonstrated how much public safety personnel needed each other's knowledge and their expertise and their understanding. Well, the 9/11 Commission recommendations and the subsequent infusion of $31 billion over the next decade helped them to meet the moment and develop repeatable, standardized, and coordinated efforts that improved response and continues to save lives. Well, COVID-19 is our 9/11, and the American Rescue Plan is our stimulus opportunity to get modern and get organized. You might say, get our ducks in a row. So how will we meet the moment? Well, while you don't have to do it for me, though it would make my life's work worthwhile, the thoughtful and strategic use of GIS can help you get there. ArcGIS is like a box full of Legos. It's basically a box full of potential. In ArcGIS, you have the core building blocks that you'll need to help modernize your preparedness infrastructure, respond to health crises, and the happily humdrum chronic health issues that we face. You can streamline your operations, and in all of this, you can keep equity right at the center. And when you connect your GIS Legos, you're building some pretty cool products. Throughout this conference, you're going to hear from colleagues like yourselves, I hope, that are doing exactly that. And some of you are really good at this, and you're creating what the public safety industry has been doing for a while now. You're creating full enterprise solutions. Side note, I'm fully aware that this is not a picture of the Starship Enterprise, but I'm claiming full creative license with it since it was created by one of my colleagues, and I think it's super awesome. And anyway, I have to tell you, I kind of like this idea of the space analogy and technology that enables this final frontier to be conquered. Our favorite space-oriented programs and literature often paint this futuristic world as utopian and guided by rational and data-driven workflows. And these ideals are really something I think we can relate to and hold up as a frame for the opportunity that stands before us, a better future for health. Now, one place to start is with data. And I'm not afraid to divulge my teenage crush. I mean, what girl wouldn't be able to resist such a big and fully functional intellect? And I think he looks great in yellow. Well, of course, this discussion is not about the character data, though I would say that he is representative of the benefit of integrated data organized in a way that can be retrieved and used with ease. This concept is exactly what Farzad Mostashari, former Assistant Commissioner of New York City's Public Health Department and the Obama administration's National Coordinator of Health Information Technology, this is what he said we need. In an article just last week, he talked about how health agencies must be able to identify and track outbreaks before they get out of control, and they must invest in the nation's public health informatics infrastructure. We may not need androids, something Apple would undoubtedly agree with, but what we need, he said, is a single national platform, a common set of tools that brings in data from every state and every county and hospital in an organized way. There would still be local control and governance of the data, but it would be standardized and interoperable across the country. Well, I'd say that's certainly a utopian notion, and we've seen actually some of this happening. And if I may say, GIS is a great option for being part of a national platform since so many health organizations already have it And geographic data enables the interoperability part so that we can do those real-time surveillance activities. So let's look at some examples of how this becomes very real. No matter how many times I say this, and it is starting to number in the thousands, the Johns Hopkins University dashboard is a great example of how this works. The dashboard was built with ArcGIS by a graduate student, En Dong, under the guidance of Dr. Lauren Gardner. It was done in just a few hours, one cold night in January of 2020. Now let me slow down for just a minute and see if you caught all of that. This was a student who created it in hours, not a developer, not a software engineer, but a student. It was in hours, not days or months or years. Furthermore, the JHU team made data sharing their first priority, and they provided that shared data in ways that others could simply consume. Thousands of similar dashboards ingested that shared data from around the world to provide localized situational awareness, and this was a powerful beginning. Lately, health departments have been interconnecting data feeds in more sophisticated ways. As you know, many people have been eager to receive their COVID vaccinations, but it can be a real challenge for local residents to understand where they can go, which vaccine is offered in various venues, and who has open appointments. This may sound simple, but to fully answer the question of where can I get vaccinated, it involves integrating data for all of the various vaccine venues along with their characteristics like location, service hours, phone numbers, scheduling methods, and the vaccine brand that's being delivered. It also requires interconnectivity with various scheduling systems that are used by these different vaccine venues. Now, to understand an individual's nearness to each venue with open appointments, we need to integrate road network data as well. I'd really encourage you to check out this great New York City Vaccine Finder tool, where they've included hundreds of both city-managed and privately run vaccination locations. And there's a lot going on here to answer just that simple question. And honestly, I'd say this is really just the tip of the iceberg. Health organizations may have 40, 50, or more data systems of record that could offer amazing insight and applications if only they were connected. Even more current, actually, is how we're using connected data systems to vaccinate homebound individuals. We're seeing organizations connect to databases that have information about local residents who are essentially homebound. Now, you could add to that list information from the HHS Empower system that maps at-risk electricity and healthcare dependent individuals. We might also include communities that are geographically distant from a vaccination site, like extremely rural places and tribal communities. And we could even pull data from our HMIS system to add people experiencing homelessness to our outreach plan. Now, those various data inputs feed into a call center so that the individuals in the call center can reach out and ask who would like to be vaccinated. Then GIS can create territories for your mobile vaccinators and optimize their routes for efficiency. Of course, you'll also want to digitally collect vaccination data while making these mobile house calls and feed that back into your immunization information system to create a very complete workflow. Now, variations on this theme are taking place in the US and abroad to give everyone the chance to be vaccinated that wants to. Now, some people have been asking me what I think comes after COVID for Health GIS. And I think, gosh, one thing is really for sure. We're never going back to normal. The virus has upended how we think, act, work, and live, and we are already forever transformed. Where I think and where I hope we'll land in some ways is kind of like going back to the future. In other words, we'll take our lessons learned and the technologies that have already existed and build on them, connect them, and extend our knowledge in efficient and formidable ways. Now, among the first things that I believe we should do is we've got to get a pulse on the new health baseline in our communities. We need updated data through new community health assessments to understand where and how things are different. Where have people been neglecting management of their chronic diseases and foregoing screening for common health issues? Are there new pockets of substance misuse or fresh breeding grounds for disease-carrying vectors where standing waters developed from derelict pools or fountains or yards? Whatever part of the health spectrum you work in, you're going to need to know what's plaguing your populations in the post-COVID world. Now, if you're not already aware, I'm pleased to tell you that just about 5 months ago, we released a new set of tools for performing community health assessments. Now, these tools follow the WHO's CASPR methodology for selecting a study area and assigning random household clusters to survey based on current census statistics. Now, once you've selected your neighborhoods to be surveyed, you can assign teams to their clusters. You can easily make those assignments, provide useful comments, and send the information along with a digital map of the area that's been assigned to each team member. It's very convenient. Then we get to the real work part. We used actually the US CDC's bank of community health assessment questions to initially populate our digital survey tool. And then we also added some COVID-19 questions, so they're in there too. Now, this survey is really easy to customize and to add new questions, or you can modify the existing questions or hide the ones that you don't even want to use. On the right, we have a dashboard that monitors the submission of the surveys in real time. So we can see things like how well are the teams doing in terms of efficiency. We can look at whether householders are being as cooperative as we'd like with the assessment. And we can also look at the overall progress toward completion of all of the required surveys. And finally, we get to the really good stuff, which is a pre-configured dashboard with the overall characteristics of the surveyed population. Again, these dashboards, since they're configurable, allow you to make them suitable for your needs. This one includes the population breakdowns by race and ethnicity, by language, pregnancy status, age cohorts, and some financial characteristics. And I think this is a really great example of back to the future because you're using your trusted industry methodologies like CASPR, then you can blast forward by modernizing the whole experience, getting the information faster and saving time, money, and potentially lives in the process. Okay, so we've started with data, but now we need to get to decisions, being strategic, optimizing operations, and being, as some might say, logical. I can think of no better representation of purely logical thinking than my friend Spock here. And while digesting universes of information may be a no-brainer for Vulcans, we mere humans could use some help with this. So if mind melding is an option for you, I personally would say go for it. But if you don't happen to be best friends with a Vulcan, then GIS can help manage multiple layers of important information to solve for the innate complexities and patterns and relationships that exist in the intricacies and the interconnections of our lives and the lives of those we serve. How can you assess where places need new resources? How can you automate long-standing and maybe tedious workflows? What new insights will you discover as you interrogate layers of information to solve strategic problems? Now, tomorrow you're going to hear more about how GIS makes networks better, advances the mission of large health systems, and enables the current use of location intelligence inside your business software systems. Opportunity abounds when we apply GIS to operational systems. And maybe you haven't always thought about the contribution of those operational systems to our overarching goals for our populations to live long and prosper. But I think that it's definitely worthy of mention. Now, one thing that we are thinking about quite a lot is health equity. And frankly, I've always seen GIS as a tool that's inherently useful in this regard. Now, we might use the example of the Borg to begin to understand how GIS supports improved health equity. It begins by identifying that cluster, or shall we say, collective of disparities in a community. Now, these are individuals who are unable to reach their own unique potentials because they're suppressed in that effort in very structural ways. And in fact, we can use analytics to help us understand how those structures have been assimilated into our policies and impacting communities. GIS can tell us where people have been robbed of access to adequate resources to support their personalized needs to achieve their best health. Now, here's an interesting example related to racism from the Minneapolis Mapping Prejudice Project. This effort took a historical look at covenants in property deeds that basically forbade the selling of homes to particular groups. They scanned 1.4 million deeds from 1900 to 1960, and they were looking for words like Jews, Japanese, Negro, Mongolian, and colored. They found 25,000 suspect deeds. And so they recruited 450 community volunteers to validate the records and help map them. Now, the whole goal here was to change the way that residents view race and space and the history of both in their city. And others have taken similar measures to get at root causes of various disparities, overlay some current vulnerabilities, and make choices that lift populations in need to ensure fair health opportunities. My mouse has just gone crazy. Okay, now on the other side of the equation, we have the process. And these are the localized policies, practices, attitudes, cultural messages, and resource landscape that contribute to producing inequities. And spatial analysis connects the process and the condition to inform and validate root causes that can be mitigated and ultimately eliminated to reach our equity goals. To increase the number of factors that we can include to get a much more holistic and realistic result. So, as we break free of the collective, since of course we really don't want to assimilate everyone into a life of sameness, we gain the opportunity to celebrate our diversity. Whether we're Jeff Bezos, whether we're Tiburonian, Betazoid, Temerian, Jem'Hadar, Romulan, Telosian, Elasian, or Ferengi. In fact, we might be Chalnoth, Benzite, Andorian, or Cardassian, but not Chloe or Kim. No matter what, we all still have the right to be healthy. I'm going to challenge you to adopt a crisis perspective to all, or at least a lot, of the work that you do. Why? Because it works. Now you might say, we're just too busy nowadays to do anything new. We're too busy to improve. And of course, I think that's a very natural reaction when you're fully embroiled in responding to the pandemic or any other crisis for that matter. And as health professionals, I know that we all care deeply about this huge responsibility that we have for the populations that we serve. However, I remain convinced that a crisis is actually the perfect time for innovation and change that ultimately helps you to achieve your goals faster. There is some evidence to support this concept, whether we look at the prototypical hero's journey, where the status quo of our normal world is suddenly interrupted by a change, and then the hero has to think differently to adjust to the new reality. Or we could examine the evolutionary cycle that becomes activated by a new requirement in the environment to either adapt or perish. And in the technology world, we might look to the Gartner hype cycle, where innovation is triggered by a consumer need event. But actually, I'd rather just use you as an example. Despite the difficult times, you came together and responded in new ways. You built thousands of dashboards, apps, and hubs. You performed complex analyses and made data-driven decisions and new policies to support your populations. You configured your GIS systems to understand where the virus was spreading, to guide aid to those who needed it most, to protect citizens with vital information, and to extend and increase services where they were lacking. You've already proved my point, but let me give you a specific example based on another crisis situation, homelessness. This is a great story of innovation in a crisis. So with just a few hours to act, San Bernardino County's Homeless Outreach and Proactive Enforcement Team, yes, they're called HOPE for a reason, well, they had to move really fast. You see, the county had had significant rain after a drought, which caused some flooding. And as a result, a dam had to be opened to divert water from the flooded areas to local riverbeds. But those riverbeds were where a lot of homeless people were living. And so I would say, if you don't know San Bernardino County, it's really big. With about 20,000 square miles to cover, how could this team efficiently dispatch staff to warn people who were at risk? Well, they used the results from the county's Homeless Activity Reporter Survey, which helped them to quickly pinpoint and alert homeless populations that lived in the floodplain. I mean, this is a really good example of mapping and sharing data between county agencies to save lives by accurately tracking where vulnerable populations reside. Well, if you're not convinced, the evidence continues. According to the Harvard Business Review, a crisis creates a number of conditions that work together to support rapid and impactful change. One of the first things that happens is that an organization unites around a shared purpose, and that enables this sense of courage to take action that might have been unthinkable during more calm times. A crisis also tends to magnify and clarify where vulnerabilities and problem areas exist, and it forces us to confront those systems that may not be working in the ways that we expected and start to see these things just a little bit differently. The other thing that happens is that there's a lot of incentive to act quickly, and that can really help to overcome bureaucratic red tape. And as you well know, a crisis can create a great deal of energy, and that energy, when it's focused on a common goal, leads to an awful lot of innovation getting done. So again, I really think that there's a lot we can do when we use that crisis mentality to take action. In addition, I'd just say we can't afford not to think about it this way. According to an article in JAMA, the pandemic has cost just the US more than $16 trillion already. But we also don't want to look back on this extraordinary moment and realize that we squandered rather than seized it. The future is now, roaring 20s or not. So we're all going through a lot of changes, and you have the opportunity to be the hero, the captain of this ship, if you will, and you can shape our health destiny going forward. In health, we should no longer be known as the ones that are single-handedly keeping the fax and pager industries in business. And I mean, no offense to the people who are working in those lines of business. For my part, I'm just kind of like a self-help guru using a bunch of mixed metaphors to remind you of what you need to do. You must boldly go where you may have never gone before. Remember, fear is the path to the dark side. Feel the force and collect your foundational data. Connect to your systems of record, learn spatial analysis, and engage your stakeholders in data-rich and engaging ways. Modernize and collaborate and bring GIS to the center. We can help you to build your strategy, to guide you through your milestones, to get your personnel trained and create new ways to see the world, if you'll let us. So take your GIS box full of potential, redesign health in our new world, and build that utopian future we all aspire to.